With me now to discuss is Dr. Isaac Bogoch, infectious disease specialist. Good morning. Thank you for joining us.
My pleasure.
So talk to us about the statistics in this report. Can you explain to us what is driving the rise, and are you surprised by it?
I think we have to remember what actually goes into this. Remember, pneumonia is any infection of the lung, and there's lots of them, right? During the COVID-19 dark days, we saw a lot of COVID, obviously. We didn't see very much flu. In 2024 and 2023, we saw a lot more influenza. So, you know, that you can have perturbations based on a very difficult influenza year. For example, the largest year in recent memory was 2018, when we had a very significant flu season, and that was the highest rate of pneumonia that we've seen in those StatsCan's reports in recent years. So a lot of this can be changed by a significant flu season or a significant year.
So speaking of changes, you know, this report also shows a decline in deaths from COVID-19. With that in mind, what can we learn about the pneumonia rise with that context?
Yeah, I was very impressed to see COVID go down as a cause of death. It peaked at about number 4 in around 2022, then it was 6th, and now it's in its 9th place, and hopefully it will continue to decline, because we obviously had some very significant years with COVID. But also remember, during COVID, while it was awful, and while a lot of people sadly died and succumbed to COVID, the overall deaths from pneumonia actually dropped. And the reason those dropped is because we weren't seeing any influenza. There was very, very few influenza cases. There were very few of those circulating and hospitalized and death related to influenza at that time. And a lot of masking, but the overall death rate from pneumonia dropped during COVID because of that. So we're probably seeing the rebound effect following all those public health measures in COVID. And, we're now having COVID, influenza, RSV circulate, and we're probably seeing a rebound effect from that. But remember, the biggest year was 2018 in recent memory for pneumonia cases and pneumonia as a cause of death.
What do you expect to happen to those numbers going into 2026?
It's hard to guess, but, I'd imagine with an aging population, we might still see it creep up. Over 52% of those deaths were sadly in people over the age of 85. This is a frail and medically vulnerable age group, and we do have an aging population. So they probably will still creep up, maybe not significantly, but bit by bit. So I think it's important to recognize that we do have to ensure that we care for our aging population. We're probably seeing the rebound effect post-COVID, and it'll probably stay somewhat consistent with maybe a slight increase. But as we say, influenza and many of these other respiratory pathogens are predictably unpredictable. So we might see some rises or falls as well.
Okay, thank you for breaking that down for us, Dr. Isaac Bogoch, infectious disease specialist.
Thank you.